So the exam begins by looking at the patients from behind. And the first thing we do is called visualization. We just kind of scan the entire spine, and you look for changes in the musculature or some asymmetries like we see here in the shoulder blades, and we kind of just take all that in. So this is the beginning of the investigative process. The next thing is we want to look for temperature changes, thermographic changes between the left and right side of the spine, because there are 31 sets of spinal nerves coming out, and with the neurocolometer I can take very careful measurements of changes in temperature, which I'll mark with this pen. As soon as that's done, I will palpate the spine, feel it with my fingers to see if there is any swelling, spasms. I'll dip into the right along the spine to see if there's changes there. I'll push on the spinous processes to see if they're tender, and then I'm going to move the vertebra and see if they're fixated. So I'll begin here, and I usually use this about every 6 or 8 inches at a time. And when I see a change, I make a little mark. Good. And we'll come in through here. You know, temperature changes, I tell the patients, are very important as part of the normal physiology in the body. And a good example of that is, you know, whenever you told your mom or your kids tell you they weren't feeling good, what's the first thing you instinctually do is you'll feel the forehead with your back of your hand, or my mother would put her cheek to my head and say, get out of bed and go to school, you're okay. But temperature is a very important part of detecting changes in our physiology. And now we're going to go up the spine here to the base of the skull, and we see something right up on top here. Okay. Now we're going to count the vertebra, because there are 12. There are 12 in the thoracics. 2, 3, 4, 5, and there are 7 in the cervical spine, 12 in the thoracic spine, and 5 in the lumbar spine. So now I'm just going to feel over the areas to see. Now there's some swelling in here. Your fingers kind of dip into an area. It becomes very obvious that there's a correlation between where the temperature changes were and where this swelling is. And it's as if the fingers kind of dip into an area of softness in here. And even down here I can see this area of swelling right along in here. Once we've established that those are common areas, then we could do motion palpation, because part of the problem we have is called a subluxation, which is a vertebra out of place, putting pressure on the nerve, causing interference in normal function. And one of those important parts are fixation. So the first thing we'll do is we'll see if the sacroiliac joints are fixated. Bend forward, please. And we can see that this right one is not moving well. Come on back. And then we'll look at this bone down in here, and this way, and turn this way, and this, and we can see that this is not moving. Now, is it tender here, Eric, when I press in?
Yeah, a little bit.
Okay. How about in here?
A little bit, yeah.
Okay. Now let's go up to this one here. That's not moving so well. It moves that way, but it doesn't move into this direction. Now tenderness along the side here.
Yep.
Right there. Yep, that's pretty obvious. 1, 2, 3, 4, 5, 6. And there's some resistance there. Not a lot of resistance there, but a lot of resistance right here. Tender in here too? Yeah, that's pretty good there. Okay, now we'll go up to here and put the back up. You can sit back now. See, his head will move really well here, but not a lot to the side here. And it's not turning well that way, and it turns well this way. So we know we've got a fixation on this side. And tender in here too. Yep, and now the very top. He bends very well this way and not this way. So we have a fixation on the right side, and it doesn't turn real well. And tender right in here, yeah? Okay, very good. Now we correlate all of these, and then we'll go look at your x-rays. So let's see what we see there now, okay?